Picture this, you're on a football field, you're running down, trying to score a touchdown, cut to make someone miss, and all of a sudden you have a sharp pain in the bottom of your big toe. Or maybe you're going up for a layup in your high school basketball game, or you're like me and just trying to survive this week's track workout. Regardless, it is possible for anyone to get turf toe, and today we're gonna break down not only what it is, how it happens, but also what you can do to manage it and get you back to doing what you love. So let's get started. Now, what is turf toe? Turf toe is another way of saying that you sprained your MTP or first metatarsal phalangeal joint. I suggest MTP, much easier saying that. However, the reason why it's called turf toe is that it most commonly occurs in athletes participating in an activity on turf, such as football players or soccer players. What ends up happening is as you go to push off, your first MTP joint has to extend and allow you to then drive yourself forward and actually move, run, walk, whatever it might be. Because turf is particularly unforgiving compared to grass, for example, this joint can become hyperextended. And when that joint becomes hyperextended, you end up spraining the ligaments on the bottom of this joint, specifically the plantar plate and the collateral ligaments of that first MTP joint. Now, the reason why this injury can become a much bigger thing than it should be, and very often in rare cases doesn't require surgery, is because everything that we do in order to move, whether it's walking, running, sprinting, cutting, you're required to push off of that big toe. So whenever you go to walk, for example, you might feel this sharp pain in your big toe due to the fact that you're pushing off your big toe and stressing those ligaments that are already sprained. This is looking at the bottom of the right foot. So you can see right here, this is that first MTP joint. You have your sesamoid bones on either side. Your flexor tendon will run right along this long axis of the metatarsal and cross this MTP joint and attaching further up. Right here in the middle, you can see the plantar plate of that first MTP joint. And if you look down specifically in this model, you can see the plantar plate here and then the collateral ligaments along the side. That is what you're spraining when you have turf toe. All right, so we've talked a lot about what turf toe is and how it occurs, but it's time to get into the fun stuff of how you can actually treat this injury and get you back to doing what it is that you love. Initially, because there was irritation of that joint and the soft tissue and ligaments surrounding it, there's going to be inflammation, there's going to be swelling, and obviously there's going to be pain. So first we just need it to calm down, and we can go about this in a couple of ways. If it's a more mild injury and you're having only a little bit of pain with walking, you may just need a stiffer shoe so that you aren't able to extend that toe as much and put it in that same position that you initially injured it in. The other thing that you can do is by taping that toe into a little bit more plantar flexion. The tape will help to provide some stability around the joint and reduce some of your pain, along with the fact of limiting that toe's ability, even when you're walking on it, to extend into that same position that you initially injured it in. In more severe cases, some people may need crutches or a walking boot in order to give that joint some support, stability, and protection. In a mild injury, the first initial 3 to 5 days, you can start to work on improving your pain-free range of motion. You can go about this in a number of ways, whether it's using Graston through that area, through the joint itself, around the toe, down into the midsole of your foot, or even just doing like a standing toe extension, progressing to a kneeling toe extension, and challenging that pain-free range of motion as you're extending that toe in a similar way that you initially injured it, but without pushing through the pain. As your pain-free range of motion continues to improve, now we can start to strengthen it and stabilize around that joint. You can do this a number of ways, whether it's doing towel crunches, arch raises, one of my personal favorites, ankle around the worlds. If you're planning on running, whether it's due to a sport or just actively are a runner, the initial thing that you should do is just start with walking, which might be frustrating, but your toe needs to get adjusted to the fact that, okay, I was annoyed, I became inflamed, I had an injury that occurred, I can't just go right back into what it is that I was doing full force and expect to be fine. There's going to be a little bit of uncomfortableness and pain, so we can get around that by saying, okay, let me introduce you in a much gentler way that I can control without as much velocity, without as much impact. And that's going to be initially walking. And then from there, you can start to work in an interval where you're walking for a period of time and then doing a light jog, and then ultimately progressing to running all out. The other thing that you should start to do in this later stage, as your range of motion is improving, you're having less pain, your strength is also improving, is starting to introduce some amount of oscillation and plyometric activity. So whether it's little pogos on one foot, or ultimately running, which has a lot of impact, progressing to some jumps and landing on that foot and making cuts and making these sport-specific activities and movements occur, that's going to fall into that later stage. The progression of working through these stages where you have the initial protection stage and then working on that pain-free range of motion, progressing to strength, and ultimately return to sport or activity progresses at different rates, not only between individuals, but also depending on the severity of your injury. So if you have what we call a grade 1 injury, it is a little bit more mild, you might be able to move through this a little bit faster. You might be in that initial stage for 3 to 5 days and then move pretty quickly over the next couple of weeks to getting back to running or basketball, football, whatever it might be. For that grade 2 injury, it's going to take a little bit longer than that grade 1 mild injury, but won't take as long as the grade 3. That grade 3 injury can sometimes be associated with a full tear of the ligament, occasionally an avulsion fracture in that joint. So if you continue to have pain and limitations in movement, motion, strength, stability, then after several weeks to months, then it might be time to seek help from your doctor and get some imaging done, because there's likely something more that's going on other than just a sprain of those ligaments surrounding the joint. Make sure you comment and subscribe. I want to hear your thoughts. If you want me to go into any more detail with anything, or if you have something specific to ask, make sure you put it down below. And if you enjoyed this video and want to see our other videos and make sure that you stay up to date with what we're posting, make sure you subscribe as well. Thanks again, and I'll see you in the next one.